Every second, another senior struggles to stand up. Half of all adults over 70 are trapped by chronic joint pain. The pills meant to help are now linked to 16,500 deaths each year. But 4,000 years before ibuprofen existed, a golden spice was easing pain and preserving memory across entire cultures. Why do some of the world's healthiest elders still trust this ancient remedy? And does the science finally prove they are right? The answer demands a closer look at what has been hiding in plain sight. Half of Americans over 70 live with chronic joint pain, a daily burden that disrupts sleep, limits movement, and erodes independence. Arthritis alone affects 54 million people in the United States, with rates climbing sharply as age advances. For many, the first line of defense is a familiar over-the-counter pill, non-steroidal anti-inflammatory drugs such as ibuprofen and naproxen. Yet these medications come with a hidden cost. Each year, 16,500 Americans die from gastrointestinal bleeding linked to long-term use of non-steroidal anti-inflammatory drugs. The risk is not just theoretical, it unfolds in hospitals and clinics across the country. Seniors who often juggle multiple prescriptions and chronic illnesses face even greater danger. Prolonged use of non-steroidal anti-inflammatory drugs is tied to increased rates of heart disease and kidney damage, two complications that can turn manageable pain into life-threatening crises. For those over 70, the dilemma is stark: endure persistent pain or gamble with medications that may do as much harm as good. This medical crossroads has left millions searching for safer, evidence-backed alternatives, options that can ease pain without risking vital organs or shortening lives. Turmeric's story stretches back over 4 millennia, woven into daily life and healing traditions across South Asia. Ancient Ayurvedic texts describe its use for easing discomfort, supporting digestion, and even tending wounds long before modern medicine put a name to inflammation. The spice's vibrant yellow-orange color is more than just a marker of tradition. It comes from a family of compounds called curcuminoids, with curcumin as the most studied. Despite turmeric's golden hue, curcumin itself makes up only about 3 to 5% of the spice by weight. This small fraction carries the bulk of turmeric's anti-inflammatory promise. India, where turmeric is a kitchen staple and a ritual ingredient, stands out in global health statistics. Researchers have observed that rates of age-related conditions like Alzheimer's disease are notably lower in India than in many Western countries. While diet is just one piece of a much larger puzzle involving genetics and lifestyle, the daily use of turmeric has drawn scientific curiosity. Nutritionists point to this long-standing culinary tradition as a clue worth investigating, especially when searching for gentler ways to manage pain in older adults. What sets turmeric apart is not just its history, but its chemical profile. The modest amount of curcumin present in each spoonful has inspired decades of research into how this ancient remedy might fit into modern strategies for joint pain. How does curcumin actually work inside the body to calm inflammation and protect joints? Inside each cell, curcumin takes aim at inflammation on several fronts. Unlike a single-purpose drug, this compound works across multiple biological pathways. A rheumatologist who specializes in osteoarthritis explains that curcumin inhibits the COX-2 enzyme, the same target as many common anti-inflammatory medications. That pathway is responsible for producing prostaglandins chemical signals that drive pain and swelling in joints. Curcumin's reach goes further. It also blocks a molecule called NF-kappa B, a master switch that turns on the body's inflammatory response. When that switch is flipped by stress or injury, it signals the production of inflammatory cytokines, messenger proteins such as interleukin-6 and tumor necrosis factor alpha, which fuel joint pain and stiffness. By interfering with these signals, curcumin helps turn down the volume on chronic inflammation. Laboratory studies show it reduces levels of several key cytokines, including interleukin-1, interleukin-6, and tumor necrosis factor alpha, all of which are elevated in arthritis. This multi-target approach means curcumin can dampen inflammation at its source, not just mask the pain. The same rheumatologist notes that curcumin does not just block one pathway, it acts more like a conductor, quieting an entire orchestra of inflammatory signals. Curcumin also acts as a potent antioxidant. Inflammation produces free radicals, unstable molecules that damage cells and speed up joint deterioration. Curcumin neutralizes those free radicals, helping to protect joint tissues from further harm. This antioxidant effect is especially important for older adults whose natural defenses may be weaker with age. These mechanisms help explain why curcumin shows promise for long-term joint health. But there is a catch. For these effects to matter, enough curcumin has to reach the bloodstream and the tissues where it is needed. Achieving those therapeutic levels is a challenge, and it is one reason why how you take curcumin matters as much as the dose itself. Clinical trials have moved the turmeric conversation beyond tradition and into the realm of evidence. In 2014, a randomized controlled study published in Clinical Interventions in Aging compared 1,500 milligrams of standardized curcumin extract daily to 1,200 milligrams of ibuprofen in patients with knee osteoarthritis. After 4 weeks, both groups reported similar reductions in pain and improvements in joint function, as measured by the WOMAC score, a widely used tool for assessing osteoarthritis symptoms. The curcumin group, however, experienced fewer gastrointestinal complaints, with only one participant withdrawing due to stomach issues, compared to 7 in the ibuprofen group. These findings are echoed in a 2021 review of 15 randomized controlled trials, which concluded that curcumin relieved osteoarthritis pain and stiffness as effectively as common non-steroidal anti-inflammatory drugs, but with a milder side effect profile. A meta-analysis of 8 trials found curcumin offered a 3.6-fold decrease in pain scores compared to placebo, a result on par with pharmaceutical interventions. Patients also reported functional gains, including better mobility and improved physical performance, outcomes that matter most to those hoping to remain active as they age. Across these studies, adverse events were rare and generally mild, most often limited to minor digestive discomfort, while groups taking non-steroidal anti-inflammatory drugs reported a higher incidence of gastrointestinal and kidney-related side effects. Rheumatologists reviewing these results point out that while curcumin's efficacy rivals ibuprofen for short-term symptom control, most studies lasted only 4 to 12 weeks. Larger and longer trials are still needed to confirm benefits and safety over years of use, especially in older adults with complex medical histories. Still, the consistency of these findings has prompted many clinicians to consider curcumin as a legitimate adjunct for managing joint pain, particularly for patients at risk from prolonged use of non-steroidal anti-inflammatory drugs. These clinical outcomes make one fact clear. Turmeric's promise is no longer just theoretical. Yet the next hurdle is not whether it works, but how much of it actually reaches the bloodstream. A challenge rooted in the body's ability to absorb curcumin efficiently. Curcumin's scientific promise meets a stubborn biological obstacle. The body absorbs only about 1% of it when taken orally. Even large doses of turmeric or curcumin extract pass quickly through the digestive system, and the liver and intestines transform them into inactive forms before much can reach the bloodstream. Clinical pharmacologists point out that this rapid metabolism, mainly through a process called glucuronidation, renders most of the active compound unavailable to the joints where it is needed most. For seniors hoping to match the results seen in clinical trials, this low bioavailability is more than a technical detail. It is the difference between real relief and disappointment. The solution, at least in part, comes from an unexpected partner: black pepper. Piperine, the active molecule in black pepper, can boost curcumin absorption by up to 2,000%. It works by temporarily slowing the enzymes in the gut and liver that would otherwise break curcumin down. When curcumin and piperine are taken together, blood levels of curcumin rise sharply, making therapeutic effects far more likely. Many supplement makers now include piperine, sometimes under the trade name bioperine, directly in their formulas to ensure that more curcumin gets into circulation. Piperine is a simple addition that changes the pharmacology, but this shortcut is not without risk. Piperine's ability to block metabolic enzymes is powerful, but non-selective. It does not only affect curcumin, it can also change how the body handles dozens of common medications. Drugs like warfarin, statins, some diabetes pills, and certain antidepressants all rely on the same enzyme systems that piperine disrupts. In some cases, this can lead to unexpectedly high drug levels, increasing the risk of side effects or toxicity. For example, a senior taking warfarin to prevent blood clots could see their blood become too thin, raising the chance of dangerous bleeding. Pharmacologists stress that anyone using curcumin and piperine combinations, especially older adults on multiple prescriptions, should consult their physician before starting a regimen. The promise of better absorption is real, but so is the potential for unintended drug interactions. For those determined to try turmeric for joint pain, understanding the balance between benefit and risk is essential before moving forward with a daily routine. A nutritionist lays out the daily routine that brings turmeric benefits from research into real life. The first step is hitting the right dose. Clinical trials point to a therapeutic target of 1,000 to 1,500 milligrams of curcumin per day, divided into 2 or 3 doses. For most people, this means combining several approaches: a morning cup of golden milk, a midday turmeric tea, and a supplement with dinner. Golden milk is a traditional recipe that blends 1 cup of warm milk, dairy or plant-based, with 1 teaspoon of turmeric powder, 1/4 teaspoon of black pepper, 1/2 teaspoon of cinnamon, 1 teaspoon of honey, and a pinch of ginger. Black pepper is not just for flavor. Its piperine boosts curcumin absorption by up to 2,000%. The fat in milk helps as well, since curcumin dissolves best in oils. Sipping this blend at breakfast starts the day with an anti-inflammatory boost and improves absorption. Turmeric tea offers another option. 1 teaspoon of turmeric powder simmers in 2 cups of water for 10 minutes. After straining, black pepper, honey, and lemon juice are stirred in. Drinking this tea twice daily provides a steady supply of curcumin and is easy to fit into any routine. For those who enjoy cooking, adding turmeric and black pepper to curries, stews, or rice dishes is a simple way to fold the spice into meals. Using healthy oils or fats in these dishes further improves absorption. Supplements fill the gap for anyone who struggles to reach therapeutic doses through food alone. Look for curcumin extracts standardized to 95% curcuminoids, with piperine or bioperine listed on the label. The typical dose ranges from 500 to 1,000 milligrams, taken 2 or 3 times a day, always with food. Not all supplements deliver what they promise, so third-party testing is key. Choose standardized, tested products when possible. Results take time. In the first 1 to 2 weeks, changes are usually subtle. By week 3 to 4, most people notice less pain and stiffness. At 6 to 8 weeks, improvements in mobility and daily function become more obvious. Consistency is essential. Skipping days or dropping below the recommended dose can blunt the benefits. For seniors who want to reduce their reliance on non-steroidal anti-inflammatory drugs, this daily regimen offers a practical, evidence-based path forward. Margaret, age 72, kept a daily pain journal after switching from ibuprofen to a high-potency curcumin supplement. Her entries tracked morning stiffness, stair climbing, and medication use. By week 4, her log showed pain scores dropping from 8 to 4 on a 10-point scale. She needed ibuprofen only once a week instead of every day. Her physician, reviewing her chart, confirmed the improvement, matched the pattern seen in several published trials. Steady, measurable gains, especially after the 3rd week. Frank, age 80, had a different story. Years of daily non-steroidal anti-inflammatory drugs led to a bleeding ulcer and a hospital stay. After medical clearance, he began a regimen of golden milk and a standardized curcumin capsule. Over 6 weeks, his pain ratings fell by half. He returned for a follow-up endoscopy, which showed his stomach had healed, and his primary care doctor noted no new gastrointestinal complaints. Frank's case highlights a trend. Some seniors can reduce or even stop non-steroidal anti-inflammatory drugs under medical supervision, using curcumin as the mainstay for pain control. Not every experience is positive. Linda, age 75, has type 2 diabetes and tried curcumin with piperine. Her joint pain eased, but her blood sugar readings dropped lower than expected. Her doctor adjusted her diabetes medication and continued monitoring, underscoring the need for caution when combining curcumin with other drugs. Behind the scenes, supplement quality remains a concern. At a local lab, Dr. Patel runs high-performance liquid chromatography on 4 popular curcumin products. 2 contain less than half the curcumin promised on the label. Only 1, certified by a third-party tester, matches its claim. Dr. Patel explains that without independent verification, consumers may unknowingly take ineffective doses. These real-world cases and lab findings reveal both the promise and the pitfalls of curcumin, clear benefits for some, but only when quality and safety are carefully managed. Physicians urge a careful approach before adding curcumin to a daily routine, especially for those managing chronic health conditions or taking multiple medications. Mild digestive upset, such as nausea or loose stools, can occur, particularly when starting higher doses. For most, these symptoms are temporary and resolve as the body adjusts. However, curcumin has a mild blood-thinning effect, and it can interact with prescription anticoagulants like warfarin and with antiplatelet drugs, such as aspirin and clopidogrel. Combining these can heighten the risk of bleeding. So anyone on blood thinners should consult their doctor and may need extra monitoring, such as regular INR checks. People with diabetes should also proceed with caution. Curcumin has been shown to lower blood sugar, which may require adjustments to diabetes medications to avoid hypoglycemia. Regular glucose monitoring is recommended when starting or changing the dose. Those scheduled for surgery should stop curcumin 2 weeks before any procedure, because its anticoagulant properties could increase bleeding during and after the operation. Gallbladder disease calls for special attention. Curcumin stimulates bile production, and it can worsen symptoms or trigger pain in people with gallstones or a history of gallbladder attacks. Pregnant women are advised to avoid high-dose curcumin supplements, since animal studies suggest it may stimulate uterine contractions. Culinary turmeric in food is generally considered safe, but concentrated extracts are not recommended during pregnancy without medical supervision. Drug interactions are not limited to blood thinners and diabetes medications. Curcumin, especially when combined with piperine from black pepper, can alter how the body processes many drugs, including statins, certain antidepressants, and immunosuppressants. Seniors managing multiple prescriptions should have a pharmacist or physician review their medication list before starting a curcumin regimen. The safest path is an open conversation with a healthcare provider who can weigh benefits and risks based on individual health needs and monitor for any unexpected side effects. Today, over half of adults past 70 face daily pain, and the safest solutions rarely come in a bottle. As demand for alternatives rises, evidence for curcumin grows stronger in mainstream medicine. The choice between risk and relief is no longer black and white. Sometimes, the most powerful change starts with a single golden habit. What is your experience with turmeric? Share your thoughts below.